the nerves that will supply involuntary muscles of the body. So the nerves that will supply involuntary muscles of the body, we call them autonomic nerves. And the nerves that will supply voluntary muscles of the body, we call them the somatic nerves. So any component of the body that is involuntary is autonomic, that is automatic, right? And the component which is voluntary, which is under our control, that is known as somatic. Got it? So if we talk about the uh, basic structure of our nervous system, right? So basic structure of our nervous system. So we have a central processing unit, like the laptops, we have a CPU. In body, we have a CNS. So central nervous system is the one that will control each and everything in the body. So CNS means the brain and spinal cord. This will control each and every component of our body parts. This will also control our peripheral nerves. So we have a CNS, that's a central nervous system. We have a PNS, that's a peripheral nervous system. So CNS is the one that will control our peripheral nerves also. Now we have two types of peripheral nerves in body. Everybody knows. One is known as sensory nerves, second is known as the motor nerves. So we have two types of peripheral nerves. One is known as sensory, one is known as motor. So CNS control everything. CNS means the brain and spinal cord. And the nerves which are present outside brain and spinal cord, we call them the peripheral nerves. And these peripheral nerves can be of two types. These peripheral nerves can be of two types. The nerves can be sensory, the nerves can be motor, right? Now, if we talk about the sensory nerves, if the sensory nerves will come from any involuntary structure of the body, if sensation come from any involuntary structure of the body, that is known as the autonomic component. And if the sensation will come from voluntary component of the body, we call it a somatic component. So accordingly, we have a autonomic sensory, we have a somatosensory. So we have somatosensory, it means the sensation is coming from the voluntary component. And we have a autonomic sensory, it means the sensation coming from the involuntary component of the body. And this system is collectively known as sensory nervous system. So this system is collectively known as sensory nervous system. So this is our sensory nervous system. If the sensation coming from involuntary part, we call it autonomic. Sensation coming from voluntary part, we call it somatic part, right? Now, if we talk about the working of our nerves, like whether we talk about peripheral nerves, sensory nerves, motor nerves, we talk about any nerves. So all the nerves will work with the help of ions or the electrolytes of the body. So the most important component for the conduction, for the nerve conduction is ions. So ions and the electrolytes of the body are the most important component for the working of the nerve. So how the nerve conduction take place? You people must have covered in physiology how the nerve conduction take place with the help of sodium and the potassium ion mainly. So sodium takes entry in a neuron, that neuron get depolarized. Potassium comes out, that neuron get repolarized. So ions and electrolytes is very important component for the working of the nerves. The test that we ask for the patient to undergo is known as the serum electrolytes. So whenever we want to know the status of the electrolytes in our body, whenever we want to know the ion status of our body, like how much quantity of sodium is there, how much quantity of potassium, chloride, magnesium, calcium are present in our body, we always ask the patient to undergo this test. We call it a serum electrolyte testing, right? So serum electrolytes are very important for the functioning of the nerves because sodium is required for depolarization and potassium is required for repolarization of a neuron. So if we talk about sensory nervous system, sensory nerves will also conduct a impulse. Sensory nerves will also carry the impulses from peripheral part of the body to the CNS. Sensory nervous system is the one that will carry impulses from the periphery part of the body to the central nervous system. So even the sensory nerves will work with the help of electrolytes. Sodium will take entry, potassium goes out. So we have a group of medicines. We have a group of medicines which can block our sensory nervous system. We have a group of medicines which can block our sensory nervous system. We call them the local anesthetic drugs. So the medicines are known as local anesthetic drugs. So local anesthetic drugs are the one which are blocker of our sensory nervous system. So the medicines are known as local anesthetics. In short, we write them as a LA drugs. So guys, any medicine that ends with the word cane, any medicine that ends with the word cane is known as local anesthetic. So can you give me some examples of drugs? Like if you people have covered the subject of anesthesia, Do you have any knowledge which medicines end with the word cane? Can you give me one or two examples? Like I can see around 600 students are watching this video right now. So out of the 600 people, how many of you can answer? So Prashant Bhushan has answered a drug that's a bit controversial drug. He has answered cocaine. So Bhushan, apart from cocaine, any other drug you know that is used as a local anesthetic? Yes, answer is like many of you have answered the question. Like we have a lignocaine, lidocaine, bupivacaine, prilocaine, procaine. But Bhushan has given a fantastic answer. It's cocaine. Okay, so cocaine is also approved as local anesthetic, but nowadays cocaine has a different utility, not used as a local anesthetic. Okay, now one question is from Prashant Bhushan now. Prashant Bhushan, if cocaine is a local anesthetic, why we call these medicines as local anesthetics? Are these medicines are of the local brand or they are of the good company? Like they are the branded medicines or the local medicines? Why we call them local anesthetics, Prashant? Why we call them local anesthetics? Are these medicines branded or local? Are these medicines Indian made or are these medicines are branded medicines? Why we call them local? So the answer is very good. So now Prashant is given the correct answer. Very good. So these medicines are given by the local route. So local anesthetics are the medicines which are given by the local route. So local means here the medicines are given by the local route. So what is the local route? Local route is a route in by which we give the medicines to at the place in the body where the medicine need not to take entry in systemic circulation. So if the medicine need not to take entry in systemic circulation to produce its effect is known as a local anesthetic, local route. So what is the local route? Local route is the route for which the medicine is given to a patient in a body, and now the medicine need not to take entry in systemic circulation. So no entry in systemic circulation. So medicine need not to take entry in systemic circulation to produce its effect in the body. That is known as the local route. So I would like to ask a question from you people. If I give medicines by inhalational route, if I give medicines by inhalational route, for example, I give salbutamol. So salbutamol is a medicine that is given for bronchial asthma. So when I give salbutamol by inhalational route, so is that considered as systemic or the local route? So when I give salbutamol by inhalational route, is that a systemic route or a local route? Can any one of you answer? Can any one of you answer this question? Salbutamol given by inhalational route for bronchial asthma, is that route local or systemic? So now you can see half of you are answering local, half of you are answering systemic. So let me tell you, when you give salbutamol by inhalational route, you are directly allowing the medicines to take entry in the bronchiole, and medicines will cause bronchodilation. Medicine will not take entry in systemic circulation to have the bronchodilator effect. So inhalational route for the salbutamol for bronchial asthma is local route. So that is a local route, not the systemic route. So half of you have answered systemic, half of you answered local. So it's a local route, guys. Now let's take one more example. So my question is, you are giving desflurane to the patient. Desflurane is a general anesthesia drug. So whenever you give desflurane to a patient by the inhalational route as a general anesthetic, is that route local or systemic? So desflurane given by inhalational route as a general anesthetic, is that route systemic or local? So now you are thinking, है ना? Now you are taking time to answer this question because you people were trapped in the previous question. So yes, now that is considered as systemic route. So you people have to understand for the general anesthesia effect, desflurane has to take entry in your blood. Now through the blood, it will enter in your brain, and now it will produce the effect in the body. Got it? So you can say the same route can be local, same route can be systemic. So there is no problem with the route. So one route of the body we can use as a systemic route, the same route can be used as a local route also. For example, whenever I have the rhinorrhea, I can use a nasal spray. So when I use the nasal spray for the rhinorrhea, my rhinorrhea gets stopped. So that is a local route. But I can also give the various medicines by the nasal route to have the systemic effect in my body. For example, desmopressin is given by nasal route to have the effect on the urinary bladder. So I will give the medicines by in nose, but I want the effect on the bladder. So that's a systemic route. Got it, guys? So nasal route can be local, nasal route can be systemic. Now, one last question for you people. Whenever we give spinal anesthesia, so that spinal route is local or systemic? Again, an interesting question. So whenever we give medicines by spinal anesthesia, whenever we give medicines for spinal anesthesia, is that route local or systemic? Very good. So spinal anesthesia is also an example of local route. Spinal anesthesia is also an example of local route. And who will tell me which medicines are injected in spinal cord for spinal anesthesia? For spinal anesthesia, which drugs are injected in spinal cord? Which medicines are injected in spinal cord for spinal anesthesia? What is the name of the group of the medicine? So what is the name of the group of the medicines which are injected in spinal cord in spinal anesthesia? Yes, so Dr. Bharat has given the answer. It's bupivacaine, lignocaine. So I would like to know the group of the medicine. Like you are answering the medicines names like bupivacaine, lignocaine. So all they belong to which class? The answer is local anesthetics. So local anesthetics are given by local route. They can be used in spinal anesthesia. They are injected in spinal cord for spinal anesthesia. When you want to do some local work, local suturing, local procedure, again the local anesthetics are given by the local route. Now next question is, what is the mechanism of action? What is the mechanism of action of local anesthetics? So local anesthetics are the medicines. They can stop the nerve conduction. They can stop the sensory pain neurons. They can stop the sensory pain neurons so that the pain cannot reach up till the brain and patient will not receive the pain. Patient cannot feel the pain while the surgery. So these medicines can stop the nerve conduction. These medicines, local anesthetics, will act by stopping the nerve conduction. So if I say how these medicines can act in the body and stop the nerve conduction, yes, so many of you have already answered this question. That is sodium channel blocker, right? So medicines mainly act as sodium channel blocker. So medicine is mainly action as a sodium channel blocker, but when I increase the dose of the medicine, these medicines also block the potassium channel. So these medicines are mainly blocker of sodium channel, but when we increase the dose of the medicines, these medicines also block the potassium channel. The main action is sodium channel blocker, but the second action is potassium channel blocker. Now, what will be the side effect of this medicine? Now, these medicines are given to block the sensory neurons only. These medicines are given to block the sensory neurons only. But the problem is, if these medicines will take entry in systemic circulation, so you give local anesthetics by the local route, but if these medicines will take entry in systemic circulation, if the local anesthetics will take entry in systemic circulation, they will go to your heart and block the sodium channels in heart. So these medicines will go to the heart and block the sodium channel in heart. The side effect of medicine is known as cardiotoxicity. So local anesthetics, which are blocker of sodium channel. So these medicines, if they're given by local route, ideally they should act only at the local level. But there is a problem. You're injecting at the local level, but these medicines through the help of veins can enter in the systemic circulation. And once these medicines enter in the systemic circulation, they will block the sodium channel everywhere. And the sodium channel is required for the conduction of the heart. So medicines can lead to cardiotoxicity. These medicines will also stop the conduction in the CNS. Medicines can result in CNS toxicity. So two important systemic side effects of local anesthetics are cardiotoxicity and the neurotoxicity. So cardiotoxicity, neurotoxicity are two important systemic side effects of local anesthetic drug. Now here you people have to answer me one question. Which medicine is most cardiotoxic local anesthetic drug? What is the name of the drug which is the most cardiotoxic local anesthetic drug? So you people are supposed to answer. Very good. Dr. Sankalp Bhattacharya has given us an example also that whenever we give infiltrative anesthesia, the people can have the cardiotoxicity that is caused by which medicine? Answer is bupivacaine. Yes, so bupivacaine is a medicine. Bupivacaine is a medicine. Bupivacaine is a medicine that is a most cardiotoxic medicine, can result in ventricle type of arrhythmias. So this is one example. Now, guys, can you please tell me what is the side effect of lignocaine? Whenever lignocaine enters in our systemic circulation, which what is the main manifestation of the lignocaine toxicity? So bupivacaine toxicity, everybody knows. We know that bupivacaine is most cardiotoxic. The solution of the problem is we give a congener of bupivacaine these days. So we have a medicine that is a metabolite of bupivacaine. We call it a levobupivacaine. That is more commonly used. So lignocaine when it is given as a local anesthetic, which side effect is most important side effect that we need to consider? One is bradycardia. That's fine, Dr. Sanjay, Dr. Anuj. But the more important thing is very good. Dr. Pratush Chaudhary has raised a concern कि sir neurotoxic कौन सा होगा? If cardiotoxic is bupivacaine, तो obviously Pratush, I'm asking a question about a lidocaine. That is the most neurotoxic drug. So lidocaine is a medicine that will cause the CNS toxicity. Lidocaine is a medicine where the CNS toxicity is very common, and I will come back to this question again. I will come back to this question again. You people have to understand, Dr. Stuti, Dr. Anil, Dr. Nahama, you people have to understand that जो lidocaine है, it's an anti-arrhythmic drug. It's a very unique medicine, so it will not lead to arrhythmia as a side effect. So it will not cause cardiotoxicity much. Rather, lidocaine or lignocaine, when it enters the systemic circulation, we are more concerned about the CNS toxicity, not the cardiotoxicity. One aspect we'll come back to when we'll come back to this concept again. Now, you people have to understand, whenever we give the high dose of this local anesthetics, whenever we give high dose of local anesthetics, initially they block the sensory neurons, but later on they also block the sense motor neurons. So high dose of local anesthetic medicines, they will block the nerve conduction, they block the sodium channel, and we know that the sodium channels will open more number of times in sensory nerves. Sodium channels will open, or the sensory neurons are very fast acting neurons. That's why those are first affected. The motor neurons are later on affected in the high dose. So when the motor neurons are affected, the patient heart rate can go down, patient BP can go down, patient respiration can go down. So all these are the side effects of local anesthetics in high dose. So in high dose, when the motor centers, motor neurons get affected. So motor centers and the motor neurons get affected. The patient can develop bradycardia, patient can have the hypotension, patient can have the decreased respiratory rate that is seen in the high dose of local anesthetic drugs. So all these things we have discussed about the basics of local anesthetics. The system is known as sensory nervous system. These sensory nerves can be of two types, can be autonomic sensory, can be somatosensory. Autonomic sensory means the sensation coming from involuntary component, and somatosensory means sensation coming from the voluntary component. Now let's come back. Let's come to this motor nerves. If we talk about the motor nerves again two types. Motor nerves can supply involuntary muscles. We call them the autonomic nerves. Motor nerves can supply the voluntary muscles. Motor nerves can supply the voluntary muscles. We call them the somatic nerves. Right? So voluntary muscles, somatic nerves. Involuntary muscles, autonomic nerves. So the system which will supply the voluntary muscle, we call it somatic nervous system. Now somatic nervous system means the nerves that will supply voluntary muscles, and the voluntary muscles of the body can be the skeletal muscles, can be the somatic muscles, right? Dr. Misha Bansal wants to know how to know which drugs given by any route will produce local or systemic effect. Misha, that is a preparation of the drug. Like we manufacture a drug in such a way, like if I inject the medicine, that medicine has more tendency to retain at one place. I will manufacture a drug in such a way that I will make the medicine less lipid soluble. So the medicine will stay at one place, medicine will not go to the other parts. So that's the manufacturing changes. Manufacturing changes I can made in a drug. So that will make a medicine local acting or systemically acting. So that's out of scope of this lecture, because that is more commonly asked in pharmacy exam. So in pharmacy, students, we people teach them how to make a medicine lipid soluble, how to make a medicine lipid insoluble. Being as a doctor, we people have to understand that whenever we have a local problem and we can access that route by the local route, always we prefer the local route. So local route is always preferred because the side effects are going to be less by the local route. Okay. So as a doctor, we people have to understand the clinical things. Okay. So let's talk about the somatic nervous system. Somatic nervous system is the one that will supply our voluntary muscles. So we have two types of voluntary muscles. We have a skeletal muscles, we have a somatic muscles. Now skeletal muscles, everybody knows, are those muscles which will participate in body movements. So skeletal muscles are those muscles which will participate in body movements, right? And what are the somatic muscles? So somatic muscles are your facial muscles. Like you people have already covered the anatomy class. So the muscles of our face are derived from special embryo arches. So we have special embryo arches, and the muscles that we derive from special embryo arches, we call them the somatic muscles. So muscles of your facial region, for example your face muscles, your tongue muscles, your eye muscles, your forehead muscles, so all your muscles of the face are the voluntary muscles, but they are not the skeletal muscles. So facial muscles are voluntary, but they are not skeletal muscles. So we call them the somatic muscles. So somatic muscles are muscles of your face. They are derived from the special pharyngeal arches of the embryo, right? So like the facial muscles, you can change your facial expression as per your requirement. Like I can give you a smiling face, like this way I can give you a smile. I can also show you the frowning, like this way. You people are not doing good. You people have to give me the proper answer. So in this way I can change my facial expression. Tongue muscle is a voluntary muscle, so every female will answer here. The tongue muscle is the strongest muscle of the female body. Now with the help of this muscle they can kill anyone. So with the help of tongue muscle, the females can kill anyone. The strongest muscle of female body is the tongue muscle, right? So all these are voluntary muscles of the body. You have to understand, we call them somatic muscles. Now in somatic nervous system, if we talk about the basic functional unit of somatic nervous system, the basic functional unit of somatic nervous system is neuromuscular junction. So we call it NMJ. It's a neuromuscular junction. So in a somatic nervous system, we have a presence of neuromuscular junction. And in this neuromuscular junction, there is a neurotransmitter that is released. So neurotransmitter is a chemical that is released by the motor nerves in periphery. So if we talk about the motor nerves, one important thing is electrolytes that we have already covered. So all sensory nerves and motor nerves, right? They work with the help of our electrolytes. This is what we people have already covered. Now the motor nerves also release neurotransmitter. Motor nerves also release neurotransmitter in periphery. Sensory nerves release neurotransmitter in CNS. You people have to understand. Motor nerves release neurotransmitter in periphery. Sensory nerves release neurotransmitter in CNS. Sensory nerves release neurotransmitter in CNS. Motor nerves release neurotransmitter in periphery. So right now we are discussing the somatic nervous system, and I am saying the neurotransmitter that is released in somatic nervous system. Neurotransmitter that is released in somatic nervous system, the name of the neurotransmitter is acetylcholine. So this system, that is a somatic nervous system. So this system is also known as cholinergic system, which can release acetylcholine as a neurotransmitter. Now this acetylcholine, when it is released, this acetylcholine will act on a receptor. So the nerve will release acetylcholine. Acetylcholine will act on a muscle, and the muscle is having a receptor, and the name of the receptor is, what is the name of the receptor? So the unit is known as neuromuscular junction. Acetylcholine is a neurotransmitter. It will act on a receptor. What is the name of the receptor? Yes, so the name of the receptor, the answer is given by Prashant Bhushan, right? So we are privileged that we have a very important person with us who is a Prashant Bhushan. So Prashant Bhushan, you also share a name with the Minister of Delhi. You share sharing your name with a minister in Delhi. Very good. So one few students are very smart. They are answering. The name of the receptor is acetylcholine receptor. Very good. So you people are smart people. We also have a smart people with us, right? So we call them. They are answering which receptor is present. They are answering acetylcholine receptor is there. Very good. Wonderful. Now I want to know what is the name of the receptor. So the name of the receptor you can take out from the NMJ. So the unit is known as NMJ, neuromuscular junction. You can take out the first two alphabet. So first two alphabet is the name of a receptor. The name of the receptor is NM receptor. We call it a nicotine receptor muscle type. So we have a nicotine receptor. Nicotine, you people understand, nicotine that we smoke, that we also sometimes crush with our palms and all, and then we put it in our mouth. So that nicotine I'm talking about, right? So nicotine receptor is of two type. If this nicotine receptor present over muscle, we call it NM type. If this nicotine receptor present over neuron, we call it NN type. So here we have a muscle, so the receptor name is NM. So what is the basic unit? The basic unit is neuromuscular junction. In this neuromuscular junction, the neurotransmitter released is acetylcholine. This acetylcholine will act on NM receptor, and as a result of that, the muscle is always contracted. That will result in muscle contraction always. The muscle is not relaxed whenever, as long as acetylcholine is released. So muscle is always contracted in this system. It means if I talk about my voluntary muscles, like if I say biceps, so on my biceps, which receptor is there? The answer will be the NM receptor. So biceps is my voluntary muscle. On the surface of my biceps, I have a NM receptor. So acetylcholine will act on NM receptor and this will contract my biceps. So whenever my brain will give a signal, that this is the time for the biceps contraction, acetylcholine start getting released, and this acetylcholine will contract the biceps. So when my brain will give a signal, now this is the time to relax biceps muscle. Now the acetylcholine release is stopped. So we can say like this way: whenever the acetylcholine is released in this system, this will act on NM receptor. The muscle is always contracted, and whenever the acetylcholine release is stopped, the muscle get relaxed. So acetylcholine release in this system associated with a muscle contraction, and we have a group of medicines which can block this NM receptor. We have a group of medicines which can block this NM receptor. We call these medicines as skeletal muscle relaxants. So these medicines are known as skeletal muscle relaxants. So skeletal muscle relaxants are the medicines which are blocker of NM receptor. So skeletal muscle relaxants, the full form of SMR, the mechanism of action, these medicines are blocker of NM receptor. These medicines can block the somatic system, paralyze our skeletal muscles. That's why we call them skeletal muscle relaxants. So medicines are known as skeletal muscle relaxants. So any medicine that ends with the word curium, or any medicine that ends with the word curonium. So any medicine that ends with the word curium or curonium, these medicines are known as skeletal muscle relaxants, right? So curium, keronium, all these medicines are skeletal muscle relaxants. What is the mechanism of action? The mechanism of action is these medicines are blocker of NM receptor. Now as a active participants of this lecture, you people are supposed to answer me the examples of these medicines. So what are the examples of medicines which end with the word curium and keronium? So can you please tell me what are the examples? Yes, Dr. Jayashree has taken the privilege of answering as a first student. So Jayashree has answered V. Keronium. So V. Keronium is one answer. Yes, Dr. Yerukula has answered Etracurium. Christina has answered Pancuronium. Now everybody has started answering. Answers are like Etracurium, Mivacurium, Rocuronium, V. Keronium. All these medicines are blocker of NM receptor. So we call them skeletal muscle relaxant. Now, what is the clinical utility of this medicine? Where do we use these medicines? So the answer is skeletal muscle relaxants are the drugs. These medicines will completely paralyze our skeletal muscle. These medicines can also paralyze our diaphragm. So patient cannot breathe. Patient even cannot breathe when you give the medicines to the patient. So these medicines are used during surgery. These medicines are used during surgery to paralyze the limbs. So these medicines are used during surgery to paralyze the muscles, to paralyze the limbs, so that the patient cannot move his limbs during the surgery, and be as a doctor, as a surgeon, you can perform the surgery without any disturbance from the patient part. So we call them skeletal muscle relaxant. The medicines name end with the word curium and keronium. They are used during surgery to paralyze the limbs. Yes, so we called it general anesthesia. So if we talk about general anesthesia, so general anesthetics are the drugs. General anesthetics are the medicines which are blocker of central nervous system. So we have a third group of medicines, we call them the GA drugs. So we have a general anesthesia drugs. So general anesthesia drugs are those medicines that will act on our CNS, and this will inhibit all important CNS center. So these medicines will inhibit all important CNS centers, and most of these medicines which are general anesthesia drug, they will act on GABA pathway. So these medicines are the one that will promote the GABA activity in our CNS. So general anesthesia drugs are those medicines which are inhibitor of our CNS, and these medicines act by promoting the GABA activity in central nervous system. One of the example of GA drug is propofol. So propofol is one example. So propofol is a medicine. If you ask me, sir, what is the mechanism of action? What is the mechanism of action of propofol? The answer would be the propofol will act on GABA A receptor. So propofol will act on GABA pathway. This medicine can inhibit all important CNS center, right? Now, whenever we give anesthesia drugs to our patients, whenever we give general anesthesia drug to a patient, we require four things. We require total four things. So what are the four things that we people required during anesthesia? So whenever we give anesthesia, if we go to the next page, we required four important things. Number one, we required the patient should remain unconscious during surgery. We want that patient should remain unconscious during surgery. We want that patient should not feel any pain during the surgery, right? We also want that patient muscles should remain relaxed. And we also want that patient should not remember anything, whatever happened during the surgery in OT. So patient should not remember anything like what doctor was doing with the nurse during the surgery. So all these things should not come out of the OT. So four important things we required. We required the patient should remain unconscious. Patient should not feel the pain, analgesic effect. We want the muscles should remain relaxed, and we also want the patient should not remember anything. Now, for the analgesic effect, we have the medicines, we call it opioids. We have the medicines, we call them opioids. So opioids may we use fentanyl group of medicines. So we have a group of medicines which end with the word fentanyl. So these medicines can be given as a painkiller, right? So opioids, the medicines that end with the word fentanyl, these medicines can be given as a painkiller. Now, being as a muscle relaxant, I can use skeletal muscle relaxants. I can use skeletal muscle relaxants to relax all the muscles, right? So skeletal muscle relaxants can be used for the relaxation. And for the purpose of amnesia, I can give a high dose of benzodiazepine. I can give high dose of benzodiazepine, and GA drugs will also solve this purpose. So high dose of benzodiazepine like lorazepam, midazolam, diazepam, these medicines can be given in high dose for the amnesia, and general anesthesia drug will also solve this purpose. And the unconsciousness is the only thing that is given by the GA drugs. So you people have to understand these are the four things that can also be given by GA drugs alone. So whenever we give general anesthesia drugs, all the four properties can be obtained. But instead of giving, okay, so when all the four properties I want from the GA drugs, I have to give very high dose. So I have to give very high dose of GA drugs that will result in complications like coma. So you want to give only anesthesia, you give the high dose, the patient can end up in coma, and after the coma, patient can get the moksha also sometimes. So all these complications can occur. So what do we do? Instead of giving the GA drugs in high dose, we give a cocktail of the four medicines. We make a cocktail, we make a combination of four medicines. These medicines are given together so that the requirement of GA drugs will be very less. And when we require the less dose of GA drugs, then the complications like coma and mortality can be avoided. So this is the concept of balanced anesthesia. So this is the concept of balanced anesthesia. So in this balanced anesthesia, we have to give combination of four medicines. So I can give GA drugs for the unconsciousness. I can give analgesic drug like opioids as a painkiller. I can give a muscle relaxants like curium and keronium. I can give the medicines for amnesia like benzodiazepines can be given. This is the concept of balanced anesthesia. So Dr. Rida Kalim has asked me to increase the volume of the audio. So guys, can you please confirm me the volume is less or it's fine? So is it everybody is facing the issue with volume of the audio, or it is only with Dr. Rida Kalim? The problem of audio is only with one person, or is it fine? Okay, everybody is saying it is fine. So I think Dr. Rida, there is some problem at your end. Maybe the volume is not maintained. So please check your headset and maintain the volume, right? Or if there is no problem in the headset, then I think conductive hearing loss, we call it ENT में. Okay, Ayush Shukla has one doubt. So Ayush Shukla, you need not to ask me a permission. You can directly put a doubt. I am reading all your chats. I am reading all your messages. So Ayush Shukla, next time don't take the permission. Directly put a message. I will answer your query. Don't worry. So we have discussed three topics. We have discussed three topics. Now, Ayush Shukla, skeletal muscle relaxants will affect the diaphragm. Skeletal muscle relaxants will affect the diaphragm, although the diaphragm muscles will be affected in the last. And the reversal may, that is the first muscle to recover. You people know this point. And train of four appearance will occur. So that is going to be affected. The diaphragm is going to be affected. Don't worry. Yes, yes, Abdul. Diaphragm is going to be affected in high dose of SMR, right? So we know that we don't want to paralyze diaphragm, so we have to be very careful about the dosage. That is a train of four. Train of four may we have to monitor, And how we do the monitoring, that is covered in your anesthesia class. Okay. Yes, diaphragm is paralyzed. That's why we intubate the patient and we give the artificial respiration. That's the main thing. Okay, so let's start with the fourth type of nervous system. The four type of nervous system is autonomic nervous system. Autonomic nervous system is the one that will supply our involuntary muscles. So this can be smooth muscles, can be cardiac muscles. So what are the involuntary muscles? Involuntary muscles will be smooth muscles and the cardiac muscles, right? And the system is known as autonomic nervous system. Now this is a system that we are going to discuss today in detail. Rest of the topics like local anesthetics already covered in your anesthesia class. GA drugs already covered in your anesthesia class. Skeletal muscle relaxants already covered in anesthesia class, right? And if you still have doubt, guys, open any textbook. Skeletal muscle relaxants, when given in high dose, definitely paralyze the diaphragm muscle. Diaphragm is a very strong muscle. It is one of the muscle that is going to be affected in last. And the reversal may, the muscle that is affected in last is going to be recover the first. So diaphragm is first to recover and going to be paralyzed in last. So maybe faculty may have told you that we have to monitor the dose of SMR, that it should not be paralyzed. This may be a issue, but if you ask me, sir, can the medicines make the diaphragm paralyzed? Answer is yes, definitely 100%. वही testing actually, हम इन medicines को test ही इसी way में करते हैं कि diaphragm is paralyzed or not. Central part को we keep in the as a reference point. Okay, next is autonomic nervous system that will supply our involuntary muscles. So we have two types of involuntary muscles. One is known as smooth muscles, second is known as cardiac muscles. Now autonomic nerves can be of two types. Autonomic nerves can be of two types. This can be sympathetic nerves, this can be parasympathetic nerves. Autonomic nerves can be of two types, can be sympathetic, can be parasympathetic, right? So these nerves we will discuss in detail. We will discuss the physiology, then we will talk about the pharmacology, what are the various drugs that will act on autonomic nervous system. So these are the four types of nervous system that we have covered: central nervous system, sensory nervous system, somatic nervous system, and the fourth we are going to discuss now, autonomic nervous system. So we people have covered so far. Autonomic nerves are the one that will supply our involuntary muscles. Autonomic nerves are the one that will supply our involuntary muscles, can be the smooth, can be the cardiac muscles. Now, autonomic nerves can be of two types. Autonomic nerves can be of two types, can be sympathetic, can be parasympathetic, right? Now, although we have two type of autonomic nerves, one sympathetic, one parasympathetic, you people have to understand at a given point of time, we required only one. When we require sympathetic, we don't require parasympathetic. And when we require parasympathetic, we don't require sympathetic. Have you guys understood this point or not? So, although we have two types of autonomic nerves, like if you go back and check, somatic nerves are only of one type. Somatic nerves may we have only one variety, and that will only cause muscle contraction. But autonomic system may we have two varieties. One will cause muscle contraction, one will cause muscle relaxation. But at a given point of time, we required only one. So when we require sympathetic, we don't require parasympathetic. When we require parasympathetic, we don't require sympathetic. So you people have to understand, sympathetic system starts with S. Sympathetic system starts with S. So whenever we are in any kind of stress in our life, so whenever we have any kind of stressful stimulus to our life, our sympathetic system is required. And as long as we are not in stress, our parasympathetic system remain activated all the time, right? So as long as we people are not in stress, parasympathetic system, and the moment we people come in stress, the sympathetic system is activated. So like you people are listening this lecture, you people are at your home, some of you are sitting, some of you are just lying on your bed listening the lecture. So you people are relaxed, you know that I cannot see you, and when you don't have the surveillance of my eyes, you people are relaxed, you people are just listening the lecture quietly, calmly, and your parasympathetic system is activated. Now, the moment I point any one of you, like for example, if I point out Dr. Anamika Thakur, have you understood everything? Dr. Anamika Thakur, can you please tell us what is somatic nervous system? Anamika Thakur, can you please tell us somatic nervous system mein what is the basic functional unit? So 1 minute back, Anamika Thakur parasympathetic system was activated. The moment I took her name, what happened? Her sympathetic system is now activated. Now she was worried ki how sir has taken my name, right? So now she is trying to answer ki somatic system kya hai? What is the neuromuscular junction of that system? So she is now worried, right? Now the moment she come to know ki that just I just took her name to explain you the difference between sympathetic and parasympathetic. Now she would be again relaxed. She would be smiling, right? So again, her parasympathetic system is activated. So this is what happens to us, guys. As long as we people are not in stress, our parasympathetic system is active all the time. So whatever food we eat, whatever food we absorb, whatever energy we assimilate out of food, we excrete, we urinate, all the important activities done by the parasympathetic. But whenever we people come in stress, our sympathetic system get activated. That is required to fight with the stress. And now during the stress, our all normal day-to-day routine of the body get disturbed. So all important day-to-day routine by the parasympathetic. But the moment we people come in stress, our all system get inhibited for a time being. So if you really lead a stressful life, if you're leading a stressful life, so you people have to understand all your physiological functions remain disturbed most of the time of the day, and you people are very soon going to catch some disease. So this is that is why we people always say that don't take so much of stress in your life. So it's just an entrance exam. It's not the end of the world. We have so many other opportunities to become successful. So don't take stress. Take this exam lightly. Give this exam just like another exam. Okay, guys. So I just want to know one thing from you people. Whenever you go to washroom to pass urine, you require which system? Parasympathetic or sympathetic? So whenever you people go and pass the urine, so while passing the urine, we are relaxed. Yes or no? So we require which system? Answer is parasympathetic system. So while passing the urine, everybody wants parasympathetic system. But the moment when you are passing the urine, someone entered in the washroom and say, "Arey kya kar rahe ho?" So the moment someone enter and asks you ki kya kar rahe ho, what are you doing? Immediately the urine gets stopped. Right? So you were relaxed. The moment you realize that someone has entered in the washroom and now your urine is stopped, but now you realize your roommate has entered. So you know that your roommate has already seen everything. So there's nothing new for him. So again, the urine will restart. So in this way, like our parasympathetic and sympathetic will work. It totally about your brain, how the brain is perceiving that particular scenario. If the brain will receive as a stressful event, the urine gets stopped. If the brain will realize that no, it's not a stressful, it's just a roommate, again the urine will again restart. So in this way, we have a sympathetic and parasympathetic system. Got it, guys? Now we have a different realms of sympathetic and parasympathetic. Sympathetic system is also known as thoracolumbar outflow. Sympathetic system is also known as thoracolumbar outflow, and parasympathetic is also known as craniosacral outflow. Right? So we call it thoracolumbar outflow. This is known as craniosacral outflow. So sympathetic nerves are thoracic and the lumbar nerves. Sympathetic nerves are thoracic and lumbar nerves, and parasympathetic nerves are cranial and sacral nerves. So here the MCQ will be asked to you कि which cranial nerves are parasympathetic nerves. So you people have to answer me this question because you have already covered physiology. So physio class has already been over and the anatomy class has already been over. So you people have to answer me which cranial nerves are known as the parasympathetic nerve. So sympathetic nerves are thoracolumbar, parasympathetic nerves are craniosacral, and which cranial nerves are the parasympathetic nerves? So the answer is 3, 7, 9, and 10. So I am so lucky that I have got a batch which is so intelligent that most of you are able to answer the questions correctly. Yes, so the nerves are 3, 7, 9, and 10. So 3, 7, 9, 10 are the four cranial nerves which are known as the parasympathetic nerve. And you people have to answer me out of these four nerves, which nerve has the most extensive course in the body? So which nerve has the most extensive course in our body out of 3, 7, 9, 10? So out of 3, 7, 9, 10, which nerves has the most extensive course? You people have to answer me. Fast, without wasting time. Yes, not the 7. Anuj, please make a correction. Anamika, please make a correction. It's not the 7th. 7th will only supply your facial region. Yes, we have a vagus nerve. Vagus nerve is the one that will supply most of the viscera of the body. So most of the viscera till your pelvis, from your neck till your pelvis. So in your facial region, you have 379. 379 are the three nerves that will supply your facial region. And below the face, you have the 10th nerve, vagus nerve. Vagus nerve will supply all your viscera up till your pelvis. And inside the pelvis, you have the sacral nerves. Inside the pelvis, you have the sacral nerves. So 3, 7, 9, 10 are the cranial nerves, which are known as parasympathetic nerve. Now here I would like to take up opportunity to ask one more question. Guys, what is 2, 7, 9, 10? So have you people covered biochemistry? So in biochemistry, you must have covered the 2, 7, 9, 10. So can you please tell me what are 2, 7, 9, 10? So this rhyme of 2, 7, 9, 10, I would say the rhyme, or this famous kind of a, you can say, the four numbers which are oftenly pronounced together, 2, 7, 9, 10. What are these 2, 7, 9, 10? Yes, so I can see many of you are able to answer. Dr. Panang has given the correct answer. Yes, 2, 7, 9, 10 are the vitamin K dependent clotting factor. So you should be careful that you should not get confused between 3, 7, 9, 10 and 2, 7, 9, 10. 2, 7, 9, 10 are four vitamin K dependent clotting factor, and 3, 7, 9, 10 are the four cranial nerves which are known as the parasympathetic nerve. So very simple. Sympathetic system, thoracolumbar outflow; parasympathetic system, craniosacral outflow. The only thing they can ask you, the nerves which are parasympathetic. Otherwise, these names are not important. They will never ask this question from you, ki which one is thoracolumbar and which one is craniosacral. They will never ask you this thing. They will only ask you which cranial nerves are parasympathetic. The answer is 3, 7, 9, 10. Now you people have to understand, uh, sympathetic system is, the neurotransmitter of sympathetic system is noradrenaline. Neurotransmitter of sympathetic system is noradrenaline, which is also known as norepinephrine. Noradrenaline, also known as norepinephrine. So this system is also known as adrenergic system. This system is also known as adrenergic system. Now, if we talk about parasympathetic, in parasympathetic system, the neurotransmitter is again acetylcholine. In parasympathetic system, the neurotransmitter is acetylcholine. That's why the parasympathetic system is also known as cholinergic system. So parasympathetic system is cholinergic system, and sympathetic system is a adrenergic system. So here you people have to answer me one more question. Parasympathetic system is a cholinergic system. Now my question is, which is the other system we have covered in the previous slide that is also cholinergic? What is the other nervous system of the body? Which is the other nervous system of the body that is also cholinergic? Who will answer me this question? What is the name of the other nervous system of the body that is also cholinergic? So I would say parasympathetic is cholinergic. Even that system is also cholinergic. That is a somatic. So yes, very good answers, guys. So I can see many of you answered correctly. So somatic system is also cholinergic, and the parasympathetic system is also cholinergic. Now let's talk about their receptors. So if we talk about their receptors, here the acetylcholine. In parasympathetic system, acetylcholine will act on muscarinic receptor. So here the name of the receptor is muscarinic. So M is for muscle, M is for muscarinic, but here the muscles are involuntary muscles. So guys, please make a generalized concept in your mind. All voluntary muscles, NM receptor. All involuntary muscles, we have muscarinic receptor. All involuntary muscles, muscarinic; all voluntary muscles, NM. So you can see, you can go above and check again, right? So all voluntary muscles, NM; all voluntary muscles, muscarinic. Other way around. All involuntary muscles, muscarinic; all voluntary muscles, that is NM receptor. But now on the surface of involuntary muscles, on the surface of involuntary muscles, we have some other receptors also, which are known as alpha and beta. And on this involuntary muscles, we have other receptors like alpha and beta. Norepinephrine will be active during stress, and during stress, muscarinic will be switched off. So you people have to make this general concept in your mind. On the surface of all voluntary muscles, we have only NM receptor. We don't have any other receptor. So whether the person is in stress or person is not in stress, we have only one type of nerve, one type of neurotransmitter, one type of receptor, and only one outcome, that is muscle contraction. But in autonomic system, we have two type of nerves, two type of neurotransmitters, and we have two types of receptors which are activated in different scenario. Like in sympathetic time or the stressful time, we have the noradrenaline acting on alpha beta, and in non-stressful time, most of the time, acetylcholine is keep on acting on muscarinic receptor. One will cause muscle contraction, one will cause muscle relaxation. Right, Dr. Srijit, I think the concept is clear now. Concept is clear now. On the surface of voluntary muscles, we have only one receptor, that is NM. And whenever that receptor is stimulated, the muscle is always contracted. So whether you are in stress or you are not in stress, somatic system will behave only one type, that will only cause muscle contraction if it is required. But autonomic system has two nerves, two receptors, two neurotransmitter. One is activated during stress, that is alpha beta, and other, that is muscarinic, remain activated all the time, right? And this muscarinic gets switched off during stress. Have you guys understood? Now there is one special property of autonomic system that is not seen with somatic system, and that property of autonomic system is autonomic system contains ganglia. Autonomic system में we have a presence of a junction, we call it a nerve junction. So guys, so far we were talking about the muscles every time, right? So nerve muscles. So all those were nerve and muscle junctions. So whatever we have discussed so far are the nerve and muscle junctions. We call them neuromuscular junctions. Yes or no? So far we have talked about that nerve will release a neurotransmitter. Neurotransmitter will act on a muscle, and the muscle will either contract or relax in autonomic system. But in autonomic system, we also have one more type of junction. We call it a nerve-nerve junction. So this nerve and nerve junction in autonomic system is known as ganglia, right? And even in this ganglia also, all the nerves are cholinergic. So this is what the confusion is. So you people have to remember this point also. The autonomic system is the one where we have the nerve and nerve junction. These kind of junctions are not there in the somatic system. So in somatic system, we don't have the nerve and nerve junction. Nerve and nerve junction is a property of only autonomic system. And in this autonomic nervous system, what is ganglia? Ganglia is nothing. Ganglia is just a junction between two nerves. So this is the first nerve, this is the second nerve. So the first nerve will release a neurotransmitter, that is acetylcholine. So I will say all ganglia of the autonomic system are cholinergic. So all ganglia of the autonomic system are cholinergic, and now the acetylcholine released by the nerve in the ganglia will act on a receptor that is known as nicotine N receptor. So you can remember the receptor name is NN. It's a junction between nerve and nerve. So whenever we have a junction between nerve and nerve, the receptor would be NN. So NN means nerve-nerve junction. So wherever we have the nerve-nerve junction, we have NN. Wherever we have the nerve-muscle junction, there we have NM. So nerve-muscle junction, NM, nerve-nerve junction, NN. And where do we have the nerve-nerve junction? The answer is the nerve-nerve junction is a property of autonomic system, and we call it a ganglia, right? So we call it autonomic ganglia. How many have understood up till here now? How many have understood up till here? So we're moving on to the next page, starting with the physiology of cholinergic system. Starting with the physiology of cholinergic system. So in case you people have any doubt, please ask. Otherwise, I will start asking question from you. So my first question from you people, yes, Anamika has understood, Pratik has understood, Prashant Bhushan, you are my favorite student, you have understood. Indrashish has understood. Very good. So many of you have understood now. Okay, fine. So now I would like to ask one question from you. What are the three types of nerves we have covered so far? What are the three types of nerves that we have covered so far, which can release acetylcholine as a neurotransmitter? So, which nerves are cholinergic nerves in human body? So, if I ask you this question, which nerves are cholinergic nerves in human body? So, answer will be number one, all somatic nerves. All somatic nerves will be cholinergic. Number two, all parasympathetic nerves. All parasympathetic nerves will be cholinergic. Number three, all autonomic nervous system ganglia will be cholinergic. Now, this ganglia may be related to parasympathetic. This ganglia may be related to sympathetic. That does not matter. So, ganglia is a junction between two nerves, and that can be present in sympathetic nerve relation. That can be present in the कोर्स ऑफ पैरासिम्पैथेटिक नर्व। तो गैंग्लिया तो कहीं भी हो सकता है। द नर्व जंक्शंस कैन बी प्रेजेंट इन एनी पार्ट ऑफ द बॉडी, so that can be present in autonomic nerve, that can be present in parasympathetic nerve, can be present in sympathetic nerve. Now here you people have to answer me. All these nerves will release acetylcholine as a neurotransmitter. So now you have to answer, you have to type three words. You people have to type three words. You people have to tell me what is the name of the receptor in relation to these three types of system. You people have to answer me. You have to type three words and send me answer. What is the name of the receptor on which the acetylcholine of somatic system will work? What is the name of the receptor on which the acetylcholine of parasympathetic will work? And what is the name of the receptor on which the acetylcholine of the ganglia will work? Very good. So I can see Swati, Siddharth, Sahu, Tejaswini, I think, Mehul, Kaveri, it, Yalmara, Avasti. All of you given the correct answer, guys. Very good answer. So you can see we have total three different type of receptors. So nerves are of same type. All nerves are cholinergic. That's the main confusion in the body. All nerves are cholinergic except sympathetic. All the peripheral nerves of the body are cholinergic except the sympathetic. Sympathetic is only adrenergic. Otherwise, all nerves are cholinergic. But every time the receptor is different. You can see in somatic system, the receptor is NM. In parasympathetic system, the receptor is muscarinic. And in autonomic ganglia, this receptor is going to be nicotine N. And accordingly, we have the drugs. You people have to understand. Accordingly, we have the drugs like the medicines which are blocker of NM receptor. We call them skeletal muscle relaxant. Medicines which are blocker of NM receptor, we call them skeletal muscle relaxant. Medicines which are blocker of muscarinic receptor, we call them antispasmodic medicines. We call them antispasmodic medicines. They will relieve our GIT spasm. They will relieve our smooth muscle spasm. We call them the antispasmodic medicine. And we don't have any drug that will act on ganglia. That's why this topic is unimportant. Okay, so it's not important to know the ganglia because we don't have any drug that will act on autonomic ganglia. So you people have to answer me one question now. Uh, like any patient has come to you with abdominal pain. One of the patient has come to you with pain in abdomen. So which drug would you like to give? Would you like to give the NM blocker or muscarinic receptor blocker? There is a patient who has come to you in your clinic. You are the doctor posted in emergency department. Which medicine would you give? Would you give muscarinic receptor blocker or you will give nicotine M receptor blocker? देखो, we don't have the nicotine N blocker. We don't have the ganglia blocker. So that's out of question. Wonderful. So you people have to give the antispasmodic medicine. You people have to give the antispasmodic medicines to relieve the muscle, to relax the smooth muscles of the patient so that the patient pain will be relieved. Yes, Dr. Khushi Anand. Khushi Anand has given the answer dicyclomine. Dr. Priyanka Parameshwari has given the answer dicyclomine. Sankalpa has given the. Why only females are giving the answers? Why only females are giving the drug name? So dicyclomine is a medicine name that can be used. Sunil has given the answer. We call it a, yes, Buscopan. Buscopan is a drug name. Buscopan is hyoscine. So hyoscine bromide is a Buscopan. Buscopan we can try. Dicyclomine is meftal cyclopam. These medicines can be given. So antispasmodic medicines can be given. Okay, Sankalpa is not the female, it's a male. Just for the correction, Sankalp, sorry. Actually, Bengali people use the letter A in front of their name. So sorry for that. Actually, there was one of my friend. His name was Suman. So actually in North India, the Suman name is a female, but he was actually a male. So he was a Sumana actually. Sumana. So sorry for that. So Dr. Sankalp. Okay, so let's talk about next things in cholinergic system. In cholinergic system, the neurotransmitter is acetylcholine. Everybody knows. Now, how the acetylcholine synthesis will take place? So, how the acetylcholine synthesis will take place in these neurons? So, that's a very simple. Acetyl binds with choline and forms acetylcholine. So, acetyl CoA, which is a part of Krebs cycle, come from the mitochondria. Part of Krebs cycle come from the mitochondria, and choline will come from the plasma. So, acetyl binds with choline and forms the acetylcholine. Now, this acetylcholine will be stored in a vesicle. This acetylcholine will be stored in a vesicle. So acetylcholine will be stored in a vesicle, right? So acetylcholine will be stored in a round shaped structure. We call it a vesicle, and this will remain stored there. Now, whenever the body wants to release acetylcholine, what will happen? The signal will come from the brain. So signal will come down from the brain. So brain will give a signal that it is a time to release acetylcholine. And this signal is symbolized by this positive sign. So positive sign will show you that depolarization is coming down. So depolarization is coming towards the nerve ending, towards the periphery of the nerve. And when this depolarization potential will reach the periphery, now we have a special type of calcium channels which will open up. Now these are the calcium channels which will open up. We call them the transient type calcium channel. We call them the transient calcium channels. So we have the two types of calcium channels. One is known as transient, one is known as long acting. So transient means short acting, long L type means long acting. So we have two types of calcium channel, T type and L type. T type means transiently acting, they will open up for the short time, and we have a long acting calcium channels. So long acting calcium channels are L type, they are present on blood vessels. They are present on blood vessels on which amlodipine, nifedipine can act. So amlodipine, nifedipine are the calcium channel blocker that will act on L type of calcium channels blocker, which are the long-acting calcium channel blocker. Now we have a T type of calcium channel blocker, which are present over neurons. So these nerves, these are present over neurons. We also call them the N type calcium channels. So we call them the neuron type calcium channels, T type calcium channels. So they are involved in releasing the neurotransmitter. So whenever the depolarization potential reach the periphery, calcium will take entry. And when this calcium will take entry, calcium will activate the vesicle membrane. Now, how the calcium will activate the vesicle membrane? There is a presence of a protein. There is a presence of a protein on the vesicle membrane. We call it a synaptobrevin protein. So this calcium will go bind to the synaptobrevin of the vesicle, and now the vesicle membrane get activated, right? So calcium will bind to this protein, synaptobrevin protein, and now the vesicle membrane get activated. Now the vesicle membrane, with the help of synaptobrevin plus calcium, with the help of this activated synaptobrevin, this vesicle membrane get attracted towards nerve membrane. So this is your nerve membrane. So this is your nerve membrane. Now on the surface of nerve membrane, you have a presence of a protein. We call it a syntoxin protein. We call it a syntoxin protein. So calcium has activated synaptobrevin, which is there on the vesicle membrane. And now the vesicle membrane, with the help of synaptobrevin, is activated. Well, it is attracted towards syntoxin. And once it is attracted towards syntoxin, now the vesicle membrane fuses with nerve membrane. Vesicle membrane fuses with nerve membrane, and now the acetylcholine is released from this nerve. So we have the presence of this protein. We call them the fusion proteins. So these proteins are known as the fusion proteins. We also call them the snare proteins. We call them the snare proteins. We call them the fusion proteins. Now these fusion proteins can be of two types. They can be present on the vesicle membrane, or they can be present on the nerve membrane. So snare proteins can be present on vesicle membrane, can be present on nerve membrane. So if these proteins are present on vesicle membrane, we call them synaptobrevin family of protein. So we call them synaptobrevin family of protein. And if they are present on the nerve membrane, we call them the syntoxin family. We call them the syntoxin family of protein. So nerve membrane pe we have syntoxins family, and on vesicle membrane we have a synaptobrevin family. Now one of the important member of syntoxin family is SNAP25. So this is the member you people have to remember for your exam, because this is important clinically. So the name of the name of the syntoxin protein. One of the example of syntoxin protein is SNAP25 protein that is present on the nerve membrane, to which this vesicle membrane will come and fuse, and now the acetylcholine is released. Now why we are doing all this, I mean, why we are discussing all these things in detail? Because there is a drug which is important for us. The drug name is Botox. Botox is botulinum toxin. So we have a medicine, the drug name is botulinum toxin, and botulinum toxin is a drug. When given to a patient, this will go and occupy the SNAP25. And once this will go and occupy the SNAP25, now this fusion is not possible. And once this fusion is not possible, then acetylcholine release is not possible. So this drug is important for your exam because this is clinically useful medicine. So Botox is blocker of SNAP25. What is the mechanism of Botox? This is inhibitor of SNAP25 and therefore stop the release of acetylcholine. This is important, so we'll discuss in detail. So let's talk about this medicine, Botox. You people have to answer me. You people have already covered microbiology, so you already know about this medicine, Botox. So from which bacteria we have obtained this medicine? So this medicine